alaikum wa rahmatullahi. Hello, everyone. It's a pleasure to be here, and thanks for the invitation. So the bottom line, I was honored and privileged, alhamdulillah, Rabbil Alameen, to visit the northern part of Gaza twice in March and in July. I just came last week, August 1st. And subhanAllah, the north is totally different world than the south. There's 700,000 people who refuse to leave the north, physicians and other than the general public, physicians and nurses and anesthesiologists. And following up on all what you said in the beginning of the meeting, it's a real disaster. Personally impressed by the resilience of these physicians, how they can manage different pathology, and how they can manage this with very limited resources. And I am impressed also by the recovery of these patients. Like there are some patients I've seen who have recovered from very bad injuries. And I personally have no explanation scientifically to explain how these miracles happen. The famine in the northern part of Gaza is not for the general public, it's also for the physicians in every hospital, Kamal Adwan, Indonesian, and in the public affairs hospital as well. Most of the people have lost weight, 25 to 30 kilograms. There is 3 months of no food, no water, and no electricity. Now there is canned food that can go across, and you can tell how the malnourished people and patients coming to the ER. I've seen for the first time in my career, someone comes to the ER with a sodium of 178. I've never seen this in a textbook before. And I examined patients coming from Shifa after the siege, where the skin peels off, and just try to examine them from the malnutrition. There's basically skin and bone. I can't speak enough about the sniper attacks on the children, and I'm a thoracic surgeon, so I do mainly adult thoracic surgery and oncology. Most of the patients that I operated on, there are between 4 and 35 years old. Most of them, 70% of the patients were children with empyemas and fibrothorax with chest tubes left for months, and infection, Klebsiella and Pseudomonas, and no antibiotics, no insulin for the diabetic foot. My colleague from Northwestern were doing amputations every day.
Dr. Amgad, sorry for the interruption, but can you just move the camera a little bit down so that we can fix? Yeah, it's like this. Yeah, that's better. If a little bit more.
Bring it closer to me.
Yeah, that's fine. The headroom, you can just lower the headroom as well. Oh, that's fine now. Yeah, you can go on. Sorry.
Yeah. Can you see me now? Is that okay?
That's fine. Yeah, go ahead.
So I was talking about the amputations for the diabetic foots and the lack of antibiotics. Now they tested the water, and 6 out of 7 samples were positive for polio. The WHO, as you all know, is trying to arrange for vaccines for the children. So it's a real disaster. I'm talking only about the medical part, and the surgical part, which is my understanding and my profession. And I'm happy to answer any questions. I worked in Indonesian, Kamal Adwan, and public affairs. And in the south, I worked in Shuhada al-Aqsa and at Nasser, and as well as European early on in December.
Yeah. Dr. Amgad, thank you very much. I think we have 5 minutes and we still have 4 minutes to go for your commitment. If you just to enlighten us about that, what is so special about what's happening in North Gaza, about this situation, especially from a medical point of view, which maybe some media outlets cannot report scientifically, okay?
Well, as I mentioned, first the types of the pathology. It's the pathology with the malnutrition and the famine that's affecting the general public and the physicians and the nurses and the anesthesiologists. It's very obvious. They are very tired. They are very tired. They are malnourished. This is very clear. For 3 months, they have no food and no water and no electricity. So this is very particular for the north. The other thing is the prognosis. Look, if these patients are in Toronto or in the US and you see them, you just kiss them goodbye. They have very bad prognosis, but miraculously they survive. I've seen the anesthesiologist who was putting my patient to sleep for a chest procedure. He told me that he diagnosed that patient that I operated on in July. He diagnosed him back in December with pneumothorax, and he drained 1,500 cc's of blood under the stairs. And the patient survived 6 months waiting for.
A kind of miracles, yeah, I see.
He saved someone 12 years old, came into the ER with GCS of 10, and he saw brain matter coming out of her skull. And the family were preparing to put her in a coffin, taking her with the martyrs to bury her. And then they saw a physician. They told him, well, can you help? He's an anesthesiologist. So he told them, I'm not really a surgeon. So he did whatever he can, and he took the brain matter out. He sutured the skull and the scalp, and he showed me her picture 8 months afterwards, surviving. And this is stuff that you don't see in a textbook. And the other thing which I advised them to write is the limited resources. How can they So when I was there in April, Indonesian hospital was totally mess. It was surrounded by it was totally destroyed, and it was under siege. I was surprised to see it functioning in July with 4 ORs, complete ICU, and 9-bed ICU, 80 beds. How can you do this in a matter of 3 months? That's